Good afternoon. This is Monday, October 18th. I'm George Latimer, Westchester County Executive, and this is our weekly Westchester coronavirus update. As has been indicated from a week ago and in some of the other communications we've had, I'm afraid this report is not a good report. But just as when times are good, we are happy to report on good news, we're responsible to report on bad news when bad news comes before us. And I think we're seeing a trend line now in the coronavirus outbreak that has reversed the gains that we have made, and we're in the process now of looking at a rise in cases and infection, which is concerning. We'll talk a little bit about what the statistics tell us first off. From today's tracker provided by the New York State Department of Health, and I should point out that all of the reporting on testing and on cases, fatalities all go to the state, and then the state makes this available to all of us, which we can look at. We retrieve that portion of the data. We have some other data that comes to us from some other sources, but we are not the primary generator of the data. Here in Westchester County, through today, we have year-to-date 39,548 individuals that have tested positive for COVID at some point in time over the last 8 months. We factor out all of the individuals that have gone at least 2 weeks since their positive test. And that represents sufficient a number to drop out of that 39,548 total. But what's left are the people that have been infected in the last 2 weeks who have not yet cleared that 2-week protocol, and that gives us the number of active cases. Right now, we now have 1,033 active cases. That number is dramatically larger than we've been reporting in past weeks. It was a week ago that we indicated that there was a significant jump when we reached 868 active cases 1 week ago. The week before that, we were at 678 cases, and we saw the line starting to point up. But breaking 1,000, which we did on Sunday, and now 1,033 cases. The last time we had 1,000 plus cases was on Saturday, June the 6th. So from the period of time of most of the month of June, all the way through July, all the way through August, and all the way in September, we had lower number of cases. We were as low as 426 cases during that period of time. But now we've seen a rise over the last number of weeks, and now we've broken the 1,000 case mark, and that arrow continues to go up. I've mentioned a number of times that there are a number of statistics that we look at, not just the number of active cases, and those also represent some of concern. We hit a peak number of cases over the course of the last few months this past Friday with 58 people hospitalized. Just a few weeks ago, we had 22 people hospitalized for COVID. At 58 people hospitalized, we haven't hit that number since Thursday, July 9th. So we're now over 3 months since we had as many as 58 people hospitalized. And that number, which was in the 20s and the 30s for quite a while now, has jumped up to 58. That number can oscillate from day to day. On any given day, the number of people that are hospitalized and those that are released from hospitalization can make gyrations in that number. So it's not necessarily a straight line from day to day. But to be in the mid to upper 50s in hospitalization is a significant increase over what it was when we were in the around the 30 number of hospitalizations. And the fatality numbers also give us no comfort. We have 1,469 fatalities. We have lost 7 people in the last week, and we have gone weeks with no loss of life. And in the last 2 weeks, we've lost 12 individuals. Now, in the last 2 weeks, we've lost 12 individuals. From Sunday, July 19th until Sunday, September 13th, that's a stretch of almost 2 months, we lost 12 people. So we lost 12 people in about 2 months. We have now lost 12 people in 2 weeks. We've looked at some of the different activities that we've had to try to see, do they correlate to it? We mentioned, with great pride that we opened our beaches and our pools. We closed our beaches on Labor Day weekend. We closed our pools 2 weekends after that. Pardon me, this is the exact reverse. We closed our pools on Labor Day weekend. We had our beaches open for 2 additional weeks until the 19th. And we looked at the 2-week clearance period, which is the period of incubation. 2 weeks after we closed our pools, we had 552 active cases. 2 weeks after we closed our beaches, we were at 676 active cases. We have had, past the point of which either of those two things might have mattered, 400 additional active cases over a base of 600. So clearly a tremendous increase that does not correlate to different policies that we've had. All of the contact tracing that's going on right now is trying to identify the individuals who have tested positive, who they've come in contact with to try to test and isolate those individuals to try to reduce the amount of spread. When we have these many cases now that are going, our contact tracing system becomes very important. When we had 20, 30 cases in a night, contact tracing could be handled pretty much in-house with the 40 or so contact tracers through our public health department. Now we're tapping into that system that we put into effect back in the spring, which was necessary for us to go to phase 1, phase 2, phase 3 reopenings. And we're now contact tracing over a much, much larger area of people. We don't have specific information as to where the increase is coming from. It is not related to a particular spike. In fact, we were rather proud of the fact that where we had incidents, as in June in Chappaqua, the high school party, we had an incident the last week of August with 2 priests at a church in Pleasantville that we feared could be the source of a great outbreak, that didn't happen. We had our own situation in our own backyard here not quite 2 weeks ago with the county legislator testing positive and 70 members of the executive branch and the legislative branch tested, all of us negative, so that was not a spike to go up. What we do see is there are a couple of areas of great concern. One of them is social gatherings, where people take masks off. They're within social settings of people who are friends, and they don't feel the same restrictions in terms of the potential for expanding the virus. We've seen pushback from parts of the society where people either are suffering from pandemic fatigue, don't want to continue to have masks on, don't want to continue to practice social distancing, where some folks have an ideological attachment to the wearing of a mask, and for some people they just don't want to be told, have to do something, that they're free Americans and that freedom allows them to ignore this. There are some conflicting voices out there in the world. You can certainly consult Dr. Google any day that you'd like and find any alternate voices from what the professional medical community provides. And if there's a bit of sarcasm in my voice, it's because it's true. People will hunt looking for the advice that they want and find a source of something that will tell them that they can practice the behavior that they want to practice, even if they're told that it is an unwise practice to pursue. We're very concerned that this is now going to show its face in young people, which over the course of the summertime, we know that we've had a great difficulty with those age 20, slightly younger, slightly older, who resist, impacting their social interactions by wearing masks. They are less likely to get the disease, although some have gotten it and some have become sick by it. But to the greater extent, the disease affects people who are older and who have other types of issues at hand, health issues at hand. And younger folks apparently are just a much lower percentage of compliance with these situations. Whatever those reasons are, we can't just look at numbers and proceed accordingly. We're going to take a few steps today, and we'll take more steps as the day goes along. Let me hasten to add that, as was apparent back in March, Governor Cuomo has taken executive responsibility as the governor of the state to supersede the executive authority of every mayor, every supervisor, and every county executive in this county. There are emergency powers that accrue to those individuals, myself as one of them, but they are superseded by the governor. So the governor has made the decisions over an extended period of time of what will stay closed, what will open, and under what circumstances they'll open. He's recently made some decisions relative to movie theaters, a few weeks before that, gyms and health clubs. And over the course of this pandemic, he's used that judgment and his consultation to do various things. So I work within the framework of what is within my control as a county executive, and that we go to the state health department for clearance to doing a host of different things. But since this is serious, we're looking now at the beginning of some restrictions, not across the board restrictions, not yet at this point, nor are they within my authority. What is within the authority of the Westchester County Health Commissioner, Dr. Shalita Amler, she will be doing, which is to issue an order for masks to be worn in all schools in Westchester County. We have resumed education as of September. Some districts are in a hybrid mode where there's part of the schedule is remote and part of it is in class. There are some schools that are all back in school, and there are some that are all still remote. It's different district to district. However, we now are going to institute a mandate that students, wherever they are in an in-class situation, must wear a mask. And this applies to public school, parochial school, private schools, charter schools, all across the board. And the leadership of the various school districts, we've consulted with them. We have heard support for this mask proposal. It is not unique. Orange County and Rockland County have both imposed it more recently, and we believe since it's within our authority, we need to do that. Under the order, the masks can only be removed in schools during mask breaks, or when they're eating meals, or when they have vigorous physical activity, and when the teacher has determined that it may be dangerous to have the masks on. Under the order, masks also must be worn on school buses. And the order does not allow for an exception except for those who have medical issues. There is an exception allowed for that, but there are no other exceptions other than those that are for medical issues. It is our understanding, certainly from our conversation with the public schools, and we've seen this also with some of the established parochial schools, that there will be every made effort to enforce this internally. We have not attached any penalties to school districts for lack of enforcement. We will see what the level of enforcement is if we can accomplish that across the board. We know that one of the biggest differences between today and where we were 2 months ago is that there are students back in school, K-12 education, and there are students back in college, neither of which occurred during the summertime months, nor for that matter in the latter part of the spring. So we want to look at both of those two areas, impose this requirement, which we think is a common sense requirement. We're going to be making an assessment of youth sports in all of its manifestations. The Westchester County Health Department will do that. We are not prepared to shut down youth sports, but we're going to be looking at them to assess the risks and how they're being run. The safety of our kids is the highest priority, and the safety of the adults that are with the children are also of a priority. Many of them function in the not-for-profit world of the various sports programs. They function in the world of public recreational programs run by municipalities, some of them in scholastic programs. But it is clear to us that there is a spiking that is occurring because in the youth sports world, and particularly in that area of the association types, when people are involved in leagues that are not sponsored by a municipality, they're not sponsored by a school district, but they participate in leagues, they play sports, and they've been contracting this disease. We've seen it at the professional level of sports, where a number of teams and individuals have contracted COVID. Most sports are not socially distanced. Golf is, there's a few that are, individual sports, but in most cases where the team sports, they're up close play in hockey, certainly it would be true in basketball, and the chance of conveying the disease is very profound. And we're going to make an assessment on that and then make some decisions. There is sufficient power within the County Health Commissioner's role to protect public health, in which she could author orders that would restrict or limit these activities. We'll certainly defer to the state if the governor determines that this is an area of statewide regulation, and we'll defer to him, but in absence of that, we will take action. The spread is serious. People's lives are in jeopardy. We're losing somewhat more people today than we've lost in the period of time before, and to do nothing would be wrong. So we are going to take some action, make that assessment, and determine where we are. Westchester County government, as an employer, employs over 4,000 people. We recently had a separation initiative in which we lost about 5% of our workforce to try to reduce the costs of our workforce in anticipation of the problems that we'll have budgetarily because of the loss of revenue from the pandemic and the shutdown of society for the pandemic. But at one point in time, the governor issued a mandate that closed all businesses and all offices to only that which was an essential crew to work, basically requiring everyone to work remotely or at home during that period of time. Now, from that point, we've risen up to 50%, and then beyond that in county government, we are now going to assess our circumstances over the next week, and we'll be reducing the county workforce to 50% remote capacity by next Monday. We will look at the trend lines next Monday. We'll look at them every day along the lines. We'll report to you on Monday. But we believe we've reached a point at which we want to keep less people out in the community. And for those that can work remotely, certain jobs in county government and certain departments allow remote working. Certain departments, planning, budget, finance, information technology, there's some others that can work remotely. We're going to try to ensure that they do work remotely rather than report into a physical office to reduce that. Now, that has societal impacts. People who are working at a separate work location from their home location interact with the economy differently than they do when they're at home for the duration of time. But this is a concern that we have, and we are encouraging all local businesses, all local entities to make the similar assessment. We cannot mandate this, but we think that every business should make an assessment and consider how much of their workforce can return to working remote at this time. We need less people interacting with each other to spread the virus, even though we know that that has a negative effect economically. We understand that the economic impact that exists also is driven by individuals who do not feel safe going out and interacting in the society, going out to a restaurant, going out to shopping at a mall, going out to participate in different activities and services. So we have to put these numbers in the right direction in order for people to have the confidence. If we lose that confidence, there'll always be a cohort of people who will say, open up everything, and I want to participate. But that will not be a significant enough number to run this economy the way we want to. And you won't be able to argue and bully people into going out into the workplace if they don't feel comfortable doing that. So we're going to have to do this on the basis of proper health and proper science, followed by proper economic public policy. So we are making the move as a county government to reduce the workforce to 50% remote by next Monday, and we're encouraging other businesses to make the same assessment, and we'll wait to see if the state takes similar action. Many of our traditional Halloween activities can be high risk for spreading our viruses, and we have put together a best practices outline which we're going to share with schools and with municipal governments to govern what happens over the next 2 weeks as we approach Halloween. There are some lower risk activities. A Halloween scavenger hunt is a possibility, a virtual Halloween costume party. Those types of things are good. High risk activities, the door-to-door trick-or-treating, and other similar things that we think are going to be potentially much more dangerous for young people to spread. You're going to go from house to house. You're going to interact with whomever is at that front door. You have no idea where they are. They have no idea of who you are interacting at the door. There may be multiple number of young people and teenagers interacting. We think this could be a great spread of the virus. It is very difficult to share this kind of information with people and say, in essence, Halloween has to go virtual and you lose the fun of Halloween. I understand exactly what the fun of Halloween is when I was a child, when my daughter was a child. We have lost so many things that we think are important in the society. And it began at St. Patrick's Day and St. Patrick's Month, where the celebration of Irish culture and heritage had to go by the wayside. And that's happened with many different ethnicities. We went to Cinco de Mayo, Mexican heritage and culture, and of course, more recently, Italian Heritage Month. We've lost our civic holidays like Independence Day and Memorial Day to this virus. We've lost religious holidays, Palm Sunday and Easter for Christians, Passover in the spring and the High Holy Days for our Jewish brothers and sisters, Ramadan for our Muslim brothers and sisters. All of those things have been lost. High school graduations, Mother's Day where you couldn't take mom out to a brunch, Father's Day. I don't know if you take father out for a brunch, but you couldn't do that either. All of these things are sacrifices that we've made socially in the society. And we did it, and by being diligent about it, we brought the numbers down. Now, the unwillingness to continue that sacrifice, now that we're getting more tired of it, and it's going to be more difficult to do as we start to go indoors because the weather won't allow us to dine outside the way we did in the heart of the summer. All of these things now put us at risk for a second wave of this disease. And we're going to have to decide as adults exactly whether or not we've got the stamina to go through a longer period of time of sacrifice, personal sacrifice and societal sacrifice. I mentioned it the very first time back in March about how I correlate this in my mind to the sacrifice that my mother and father talked about when I was young during the Great Depression, during World War II. World War II lasted 4 years. The American involvement in it lasted 4 years. 4 years of not knowing if your brother was going to come back from the service. 4 years of not knowing if we were going to be living under Nazi tyranny or if we were going to ultimately win and freedom would succeed. And the Great Depression lasted longer than that, where jobs were lost in the late 1920s and not regained during most of the 1930s. People picked up where they lived and moved to other parts of the country because they just couldn't find work. And the Dust Bowl that devastated agriculture. These are all historical things. Most people watching would have to be significantly older than me to remember them firsthand. And I certainly don't remember them firsthand. But we sacrificed. And now what we seem to be saying as a society is we're tired of the sacrifice. We're tired of having masks on. We're tired of being told, no, we can't get up close and personal. No, we've got to have this. We've got to have this event. This is an important event for my family. And I don't care what the governor says, certainly I don't care what the county executive says, I don't care what anybody says, I'm going to do these things. And we're seeing a rise in the numbers. And those rise in the numbers are causing more fatalities and more hospitalizations. So we're going to have to take action. This is just the beginning. I hope a week from today I can report different numbers. I hope that I can report that things have flattened out. I hope that we can report in the days to come there's no need to take additional societal action, that these fairly modest steps are just steps that we used at the time, and then we were able to put this in the proper focus. But if this is not enough, then we're going to have to admit that this disease has the chance of reasserting. We've already lost 210,000 Americans. And I will tell you that we certainly try to be, in this context, apolitical and neutral. And there's certainly points of view on all sides of these issues. And there's another forum and another time to have those discussions. It's not in this situation. But I have heard people argue about the statistics, trying to argue that the number of dead weren't really COVID-related dead, that there were some rational reasons why we're counting too big. I look forward to saying there are no deaths. I think it's a plus to be able to say over the course of 2 months, as I did, that we lost 12 people instead of a lot more than that. There's no percentage in reporting bad news for fatalities, but you're looking at a statistic square in the face, and you're unwilling to accept it because it requires you to accept restrictions on your lifestyle. That's not acceptable as Americans. That is not acceptable as Westchester residents, that you would make sure that your pleasure of the moment comes before the health and welfare of your neighbors and your friends and people you know. We've all lost people from this. But the fact is that it can come close to home. It can be someone that you know and love. That's who you're trying to protect when you put the mask on. That's who you're trying to protect when you forego the event. Later this week, we'll have a State of the County message, and I'll have a chance to speak primarily virtually downstairs in the Board of Legislators chamber. That's scheduled for Thursday night, 2 weeks ago, it'll be 2 Thursdays ago, is an important date on the calendar in my responsibilities in my world. We canceled it the morning of because it was a matter of public health, because there were potentially members of the staff of the Board of Legislators and the executive branch and perhaps of the press that would put in jeopardy if we went ahead with it, knowing that we had had a potential exposure to people. And we didn't put the event ahead of human lives. We didn't put the emotion of a celebratory night where we talk about the future and we talk about it in positive terms and there's coverage and enthusiasm. We didn't put that ahead of people's health. We canceled the event. And we're scheduled for Thursday. If we have reason to cancel it, we do it again because people's health have to come first. I can't emphasize that enough. As these numbers rise, we have to take action. Now, we're taking action in a number of different ways as well. We understand the economic problems that are reaching all of the different businesses and the people in Westchester County, and that's why we've launched a program for grants and loans under the IDA program, $500,000 in that area, why we've launched a Business First program that involves up to $10 million of COVID care funds to provide grants up to $49,000 for another cohort of businesses. Those announcements are coming. We have put money aside to help people with eviction situations, landlords that have tenants that can't pay their rent, and individual tenants that can't pay their rent. So we're trying to deal with these issues as best as we can as a county government. Another one of these initiatives that comes out of our economic development team, led by Bridget Gibbons, is the Launch 1000 program. And I'm going to invite Bridget Gibbons, who is our Director of Economic Development, who will in due time call up Deborah Novick, also a member of her team, Assistant Director, to talk about the Launch 1000 program. Bridget Gibbons, Director of Economic Development for the County of Westchester.
Thank you, County Executive. Since March, the County Executive and the Office of Economic Development have been responding to the COVID-19 crisis in our county by rolling out a series of programs to help our business community. In the beginning, in the spring, we launched a program to help businesses apply for PPP and EIDL loans. We developed and launched a series of crisis advisory services, which consisted of critical webinars such as how to implement e-commerce on your website, and we partnered with RXR to launch a mentoring program to help businesses pivot, adapt, and become more resilient. The Launch 1000 program, which Deborah is going to provide more details on, is part of a broader set of business first programs that we're implementing to help our economy recover. In August, as the county executive mentioned, under the leadership of the IDA board chair and director of operations, Joan McDonald, the IDA launched a $500,000 loan and grant program to provide loans and grants to businesses to help them purchase PPE, to pay salaries, to pay rent, and really to help their business survive. Recently, we launched, as the county executive mentioned, our $10 million Business First grant program, where businesses will be receiving substantial grants to help them pay salaries, rent, the cost for adapting, and the cost for adapting to our new reality. Up to this point, our focus has been in helping the business community adapt and survive, and the Launch 1000 program is really a people-first program because the participants do not need to be a business or even have a specific idea for a business. Rather, it is designed to help those who are at home, either by choice or not, to develop a home-based income stream. Generally, our goal is to provide funding and guidance to as many people and businesses across the county as we can to help our county economy reboot and recover. Now I'm going to turn it over to Deborah Novick to provide the details on this exciting new program.
Thank you so much, Bridget. I'm Deborah Novick, and I'm so excited about this program, which will allow us to jumpstart 1,000 new businesses in Westchester County. As Bridget mentioned, we know there are people who either have no job to go back to, they have a job to go back to, but they're afraid to leave home, they can't go back to their job for some reason, maybe their own health or the health of someone they live with, or maybe it's just that the time of dislocation like this makes us stop and think, what is really important to me, and maybe this is an opportunity for me to take some time and learn something new and launch something different. So this program, Launch 1000, is fully remote. Anyone can do it completely from home. There are online tools and training, coaching and mentoring, weekly workshops, feedback from experts, and there will be lots of introductions to local economic organizations, experts, individuals who can help you launch your business and help you build a network in the business community that will be part of your future support once the program ends. Very importantly, we want everybody to be able to participate, and because the program is fully online, and we know that not everybody has access to technology to do an online program, we are so fortunate to be able to offer laptops to people who need them. So please don't let the lack of technology prevent you from applying to this program. We absolutely want to help and make it possible for everybody to do this. There is also an opportunity to earn grant money. Will be based on achieving certain progress milestones by the middle of December. So please apply early and get started. The program does require a certain amount of persistence and effort and enthusiasm on your part. It will take about 10 hours per week working from home and participating in the activities of the program to make the most of it. Applications will open soon. You can find a link for those applications on the westchestercatalyst.com website. There's also a place to sign up to receive an email when the applications launch, so please look for that. And I'd like to thank the County Executive, George Latimer, for all his leadership in these economic development arenas and for his support of the business community. And I'm looking forward to seeing all of your applications.
Thank you very much, Bridget and Deb, for this program. And I also want to point out, we're not going to discuss this one in great detail, but our Westchester Putnam Workforce Board has also made an announcement about CARES Act funding available for a program through their Experience Works program. So there's a number of different tools that the county government is trying to put in place to be helpful to businesses. We understand, the economic difficulties that businesses are going through. And as we talk about having to deal with the society and how it interacts to reduce the spread of the virus, businesses are suffering from that. We're not inured to that at all. I come out of a corporate background myself for 20 years and know that there's a direct correlation between how much money is in a person's pocket, their ability to spend it, and then how well a business does or doesn't thrive in that kind of a marketplace. So we're hopeful that these different grants, loan programs, and now this initiative for Launch 1000 will all be helpful. When we go to questions in a second, I may be asked a question about one of these topics in which Bridget or Deb, your expertise may be helpful. So if we do get some of those questions, you may just want to be at the ready so that we can call on you. Bridget, you can stay up here, Deb there. So we're all socially distanced, and I'll put my mask back on if a question comes up that is better directed to you. But I'll just summarize the comments. I've made pretty much the statement that I wanted to make. The numbers are not good. We have a responsibility to address those numbers. Wishing them away will not do the trick. It's a matter of behaviors and whether or not we're prepared to modify behaviors to deal with this pandemic or not, even though we're in the 8th month of it, even though we're bearing down on Thanksgiving and the Christmas holiday season, the New Year's season, and the calendar will turn to 2021, and we may find ourselves exactly where we are today. But the virus knows nothing of our calendars. It knows nothing of our aspirations and the things we'd like to accomplish. So we have to be prudent, make the decisions we have to make. Today's steps are really just a start. Let's hope we don't need to go any further. But if we have to go further, we will. We believe that's what Westchester residents expect us to do, is to deal with this problem forthrightly. With that, we have none of our friends from the press are in the room today. They're showing good judgment already about social distancing, but I'm sure we have a couple online. I'll ask Catherine Chaffee, our Director of Communications, to direct any questions that you may have received.
Sure, we have a number of questions. The first one comes from Nikita from News 12 Westchester. She asks, how much of the increase is because of Iona College, which has 87 cases as of last night, and what's being done about that situation?
Nikita Ramos from News 12 has asked about the Iona outbreak. The Iona outbreak is significant, but when we're looking at growth that's now been steady over the last couple of weeks, it doesn't account for what the overall jump has been. We had a night where we had over 100 positive cases, and then a couple of nights later we had another night over 100. The last night, 72. So no one of those things isn't greater than the Iona outbreak as one. We're treating the Iona outbreak as we treat all outbreaks: contact tracing, isolation for 14 days of all the individuals that have tested positive, and then contact tracing of all their contacts and results. This, once again, appears to be an activity where a large number of students were together without masks, interacting socially, and those that had the virus were able to spread it over a fairly large cohort of their friends and fellow classmates. This happened at Iona. It's happened in other parts of the state. Oneonta, notably, SUNY at Oneonta, and it can happen anywhere. It can happen with college students. It can happen with high school students. It can happen when somebody decides that we're going to have a wedding reception anyway because we've waited so long for it, and we're going to have enough guests there, and they're going to dance and party and have a good time. And we'll have a much better time if we don't have our masks on. And so what happened at Iona could happen anywhere. It could happen again. We believe that through contact tracing, we have done the same thing that we did in the Pleasantville situation or in the Chappaqua High School situation, which is we've identified the parameters of it, and we've identified it in a way that will stop it from spreading. We don't know that until 2 weeks go by and we see how many cases. And Nikita, what we also don't know is how many of these young folks suffer and then go on to either be hospitalized or worse than that. So we'll hope for the best in that score.
Okay. The next question comes from David Proper. How much can the case surge be traced back to schools, recreational sports, and the county workforce?
Well, you know, David Proper from the Journal News, I think the question is that we can't necessarily trace a large number that's multiple days to any one particular source. The county workforce, we don't believe, is the source of this, but the more people that are in a work setting, the more chances there are for the virus to spread, and the potential that somebody who's infected, maybe not in the county workforce, could then infect them by dint of being in proximity to them, where we can have those in the county workforce work remotely from home. Then we reduce the likelihood of that individual getting the disease and therefore spreading it further. And that's the reason for this. And, of course, what I've requested is that every business now make that assessment over the next week, how they can return a certain portion of their workforce to a remote setting in terms of that. What were the other parameters that they were concerned about besides the county workforce? Again,
schools and recreational sports.
Well, again, with schools, we've made the decision that we're going to impose the mask situation. We don't know exactly how widespread usage there are, but you have to wear them on buses. You have to wear them in all but meal settings and in sports settings. And we've also said that we intend to assess what the structure of youth sports is. And youth sports comes in different packages. The school superintendents assert that they're in control of the scholastic sports. Some of them have been eliminated for the season. Some are still happening, I suppose. The local municipal recreation issues are at hand, and we have our weekly call with the municipal officials. Some of them have taken the basketball rims down at recreational locations to eliminate basketball playing. Some have not, so that's across the board. I think it's these organized youth sports that are not tied to a municipal government or tied to a school district that we're going to look at. The classic example, when you think of it, is Little League, but now there are sports for soccer, leagues for soccer, leagues for hockey. They're traveling leagues. You get to a certain level of skill, and then you perform at a much higher level when you're in one of these leagues, and they travel around, and they bring students in from different school districts. So if an outbreak occurs amongst members of a hockey team or members of a soccer team, they bring that infection back to a number of different locations. It's not all clustered by geography, either through school or through municipal programs. So we're going to make an assessment, if we can, and look more deeply into those numbers and determine if we have to take some action accordingly. But, it's pretty clear that when you're engaged in a sport, that you're not wearing a mask in order for you to exert at the best possible level, get the best amount of success in the sport that you can. But there's some sports by which proximity of the players will easily infect each other, the nature of the sport. And I made that point a long time ago when we opened up golf courses, but we didn't open up basketball courses. People thought we were making a class statement about those who play golf versus those who play basketball. It's the nature of the competition that determines how likely the spread can occur. And I think now that we see some numbers starting to jump up day after day, not just one incident, here's 80 cases, but here's a day of 72, here's a day of 107, here's a day of 110. We had days, consecutive days, where we had 300 cases a day. That's what we're trying to avoid. We're trying to make sure the 100 doesn't become 300.
The next question is also from David in regard to the mask mandate. What enforcement does the county have to ensure that all public and private schools follow this mandate?
Well, the mandate, first and foremost, is going to now be issued and delivered to each of the different schools in the county. We have in Westchester County a public school system that educates the vast majority of our students. We have a private school system, some very prominent private schools that are well known. We know we have lists of them. We know how to interact with the headmasters or the leaders of those organizations. We have a series of Roman Catholic diocesan schools through the Archdiocese of New York. They're familiar with this mandate because a mandate in Orange County and in Rockland County precedes ours, and so they've already had to qualify for that. Where we have any other charter schools, I think we've got one or two charter schools. Wherever we have other religious institutions, we're going to communicate the need for that across the board. We begin by establishing the mandate and the requirement that this be done, and we're going to monitor compliance. If compliance is not there, we have the ability to fine, proportionate to the powers that the that the Department of Health have. But we felt no need to specify a penalty amount. We're dealing in a different situation in Westchester than I think we are in, say, in Rockland County, perhaps in Orange County as well. But the enforcement will come at the local level. We'll monitor it. And if we feel that any particular school, district, or otherwise is not monitoring it properly, or enforcing it properly, then we'll act more directly. And we do have leverage to be able to act more aggressively.
And the last question is also from David. Do you think Governor Cuomo needs to enact broader restrictions?
Well, I think the governor is looking to see how we in local government act and if we act responsibly. And I think his comments are pretty clear that he expects local governments, and that includes the county government, to take charge of the world that we have responsibility for. The power of the governor is pretty pretty extensive, and that he can mandate things as he sees fit. Whenever I've had any commentary for the governor, I've always expressed it in private dialogue with him and his staff. I think that's the appropriate way to go, and that's primarily because Westchester's example may not be instructive for the whole state. And when he's acting for Western New York, for the Adirondacks and for Long Island, not just Westchester County. I do think, though, that all elected officials, my fellow county executives, the mayors and supervisors across the board, any of us who hold executive authority, the commissioners of health all across the state, we're looking at these numbers and treating them seriously. And if, in fact, there needs to be a more broad-based answer, I'm sure the governor will have more than enough input to make those decisions. But in the meantime, I think he expects, just like the voters and the residents of Westchester County expect, that as county executive, I'm going to take action. And whether it's the actions to try to help businesses, as we've just described, actions to keep people safe, as we've just described, we will take action. We will not be afraid to do that. We understand it will ruffle some feathers. We're not attempting to ruffle feathers. We are attempting to deal with a pandemic, the likes of which we haven't seen for 100 years, and for which there is no roadmap for this current society that we live in, where there's Facebook and Twitter and Instagram commentary wherever you go. We expect that there'll be some negative voices, but we also expect that if we do our job, that will be the proper reward.
David actually has one more question.
Yes, one more for David Cropper of the Journal News. I want to make sure that those reporters who cover us get credit for asking these questions. So David Cropper of the Journal News.
So David asks, what other steps can the county take?
Well, David, that's what we'll do in coming weeks. I don't want to get ahead of myself and promise what phase 2 and 3 and 4 will look like. We're looking at a host of different initiatives that will affect different parts of the society. Again, I caution by saying that we're not going to get out ahead of our skis. The governor has the authority to interact more broadly with the society. When he acts, he's acting for Westchester, the Hudson Valley, and New York City, et cetera. But we're looking at other options that will go beyond the ones that I've announced today. The ones I've announced today, I think, are proportionate for what we're facing. And if we have to go further than that, we will. I'm not trying to be cute about it, but if we decide to take an action, that's when we'll announce it, rather than say we're thinking about doing these 2 or 3 things. Let's just determine what we think we can do that's appropriate, and to look every day at the numbers, to determine what's happening on the ground, and let that be the determination, not a preconceived notion that we ought to shut this down just because we ought to. It's the numbers that will inform us as to what actions we should take. So with that, I appreciate the questions from the press. If anyone else is watching from the press, you're welcome to reach out to Catherine Chaffee, our Director of Communications, 995-2932, and she'll be happy to give additional information. We're happy to talk to any members of the press individually and separately on isolated elements or issues as we go forward. I want to thank Bridget Gibbons and Deb Novak, our part of our economic development team, leaders of our economic development team, for their actions, and all of the other members of this government. We are a team. One of our members right now suffered a personal loss. Another one of our members is recuperating, but we try to be a family. And in that family, we work together to try to accomplish a common goal, and that is to serve the people of this county. I'm George Latimer, County Executive. Thank you for watching. Stay safe.